Dizziness is a frustrating topic for patients. They've typically had symptoms for a while before they'll make their way to an ear, nose, and throat physician to see if we can diagnose where that could be coming from. Pertaining directly to ENT anatomy are the cases of peripheral dizziness that arise from the inner ear. Now, one of the most classic ones we will see will be dizziness that attacks in a spinning fashion for 20 to 30 seconds, but in a recurrent nature whenever patients have certain movements, known as positional vertigo. Typically, about 75% of cases can be treated in 10 minutes in the office, with 90% of cases resolving after 2 to 3 visits. The classic form of dizziness that relates to the balance organ would include a diagnosis of vertigo. Now, often vertigo is used synonymously with dizziness, but it truly is its own diagnosis of artificial movement about you. And each of those cases deserve an evaluation and a treatment plan to try to optimize those patients' outcomes. When we see patients for dizziness, a few of them will represent inner ear problems, but honestly, more will represent a category that we call central dizziness. Even issues like panic attacks or blood pressure changes can affect the feeling of balance. So a thorough evaluation of each of those systems can be required to really dig into some of those cases of dizziness and optimize the outcomes for these patients. Many of the true vertigo qualities or peripheral dizziness diagnoses are treatable, and we will see treatments that could resolve symptoms even the day of an office appointment or with a management plan that will come into effect over the first few months after your visit. Now, we can contrast that with many of the central forms of balance issues could be a longer treatment plan, whether that relies on balanced physical therapy, optimizing blood pressure control or hydration, or even working with neurology or cardiology to optimize other health issues that could relate. But no matter what, your physicians will be on board throughout that process to optimize the outcomes. If you have any other questions on dizziness or balance, please give us a call. We'd be happy to help.